Speaking of health, everybody, also happening today, Health and Human Services Secretary Robert F. Kennedy Jr. will face questions from senators about what some critics call chaos in public health under his leadership. More than 1,000 staffers at his department now openly calling for Kennedy to resign or be fired. Joining me now is medical expert and nephrologist Dr. Frita Fisher. Dr. Fisher, it's good to see you again. Thanks for hopping on early. Let me, for starters, play some sound for you. This was RFK Jr. defending his leadership. Take a quick listen.
We've already shaken up the leadership and removed conflicts of interest. The American people elected President Trump, not bureaucrats, to set health policy. That's the MAHA commitment in action.
Now, several CDC employees resigned after Director Susan Minaras was just fired. What kind of questions do you hope that he faces before that Senate panel today?
Well, one, Markey, I hope he faces questions of his credentials, in which case we will be reminded that he's not a medical doctor, not a physician's assistant, not a nurse practitioner, not a scientist. And so he actually has no intellectual authority to be over the health of this country. And then I want them to ask him to present data, because we've got plenty of data, plenty of evidence supporting things like vaccines, especially the measles vaccines. And then I would also ask them to just take a look at what's happened to infections since he's been in office. Well, there has been a decrease in the uptake of the measles vaccines. And at the same time, we've had more measles cases in the United States than in over 30 years. We even had 2 deaths, at least, of children. And so I just want them to hold his feet to the fire strictly on facts. That's all it will take to show that, quite frankly, he's putting this country in danger when it comes to health.
So let me ask you about the previous report we just had with our correspondent, Brooke Schaefer. Florida now moving to become the first state in the country to ban vaccine mandates. Critics call it a public health disaster. What's your take on that decision?
Absolutely, it's a disaster. There are not many things where we just have a consensus on evidence, but when it comes to the vaccines, we do. We know that prior to vaccines, millions of people died from the measles. In fact, in the United States, almost every child got measles before 1957. We know that people were paralyzed from polio. People died from smallpox. That's not even debatable. So now for us to be in a position where we are putting lives in danger, it's really a sad day.
The other thing that we mentioned is that as a result of what Health Secretary Kennedy is doing on a federal level, you've got 3 states now, California, Washington, Oregon, are forming this new health agency called the West Coast Health Alliance, where all these states will focus on putting out evidence-based recommendations on immunizations and other policies. Will state-level regulations be just as effective as federal ones, or how do you see that group operating?
It's going to be a challenge because, as someone who has been board certified in pediatrics, internal medicine, nephrology, throughout my career, I've been able to quote the CDC, one steady source. Now, I believe that people are going to have difficulty knowing whom they should trust. And so that's going to be a challenge. However, I definitely applaud the efforts, and I believe that more of us as evidence-based physicians need to get together in order to give people some true evidence in order to save and to protect lives, because clearly our leadership is not doing that right now in many cases.
And doctor, just what would you tell families, who hear, the Surgeon General in Florida say, who am I to tell you what to put in your body or, what to put in your child's body? What do you tell them, when it comes to that argument?
I tell them that the things that he is saying are actually reprehensible, especially when he said that slavery was a comparison to vaccines. So what I would tell them that while slavery killed millions of people, in direct contrast, routine childhood immunizations have prevented over 508 infections, over 32 million hospitalizations, over 1.1 million deaths in children in the United States born between 1994 and 2023. And this is according to CDC data from last year, before RFK Jr. got there. I would ask them to use their common sense and listen to people who care about the evidence. This should not be a partisan issue. This is life or death, and it should unite all of us. We really need to wake up.
Dr. Frita Fisher, I know you'll be watching today closely, as are we. Thank you for taking the time, especially early in the morning. Appreciate it.
My pleasure.